Welcome, everybody. You're listening to AFSO 21's Weekend Wrap-Up Podcast. Here is your host, Kevin Ferrara.
Welcome, everyone, to another episode of the Weekend Wrap-Up here on AFSO 21. I'm your host, Kevin Ferrara, and folks, you're probably wondering again, Kev, where the hell you been? Well, folks, before we get started here in this podcast, a little update on things I've been going through. I was diagnosed with COVID-19. In fact, I had COVID pneumonia. Probably started back around Martin Luther King Day. That's a ballpark estimate, what we're figuring. I thought I just simply had a viral infection, and, I was hacking up some nasty phlegm and everything. Said to myself, I'm tough. I can suck it up for, however long. So I sucked it up for about a week. Things started getting worse and worse. That trouble breathing, I could still taste and smell everything. There was no red flags or anything for me. Went down to the local ER. They looked me over. I had a slight fever. They did a COVID test. Didn't get it back right away. So the next day, I get a pop-up email. It says, "Hey, you've got COVID-19." I'm like, "Oh, great. Congratulations." Gave me the typical, "Hey, quarantine yourself, do this and that." And, I sucked it up for a couple more days. Conditions started to worsen. I went back to the ER. They did a CT scan. And, so that's when they found COVID pneumonia. The doc's like, "Yeah, your lungs are lighting up. I can see them everywhere, the spots on your lungs." And, unfortunately, they sent me home that day. And they said, obviously, if it gets worse, come back to the ER. So tried sucking it up again. 2 days later, I'm back in the ER for the third round. And, they finally admitted me. Sent me upstairs to the quarantine room, put me on oxygen, respiratory therapy, all kinds of IVs, medication. So there I stayed for 3 nights and 4 days in the hospital, as I called it, the hotel room. Great group of doctors, nurses at the local hospital here. And, they really took care of me. But my O2 sats, they could not, they weren't going above 84 here at the house. And that's why they put me on low flow O2, 2 liters, nasal cannula. But so finally with everything, all the medication, respiratory therapy, oxygen, we were able to get my O2 sats back up to where they're supposed to be, 97, 98, 99 range. They sent me home after that. I was on some home meds and, everything cleared up. But like I told everybody, if something's out of whack, something just doesn't seem right, get your ass down to the doctor, whether it's, an ER, your regular doctor, these pop-up clinics that are around, and get yourself in, get checked. We're good to go now. We're back in action. I'm back here on the air with the podcast, back down to the firehouse. I was down there the other day talking to the guys. Cause honestly, the first 2 days I was sick, I was unconscious. I was sleeping for 2 days straight. Lost about 30 pounds, which is good, but I'd rather not lose weight that way. But it's crazy. So, as with, anything, you, the audience members, you know your health, what's normal, what's not normal. But like I said, if something just seems out of whack, doesn't matter what it is, give your doctor a ring, go in, get it taken care of. Cause like I said, I thought it was just a simple viral infection. I had the coughs, had a headache. Here it turns out, boom, I had COVID plus pneumonia, which that's not a good combination. So folks, it's great to be back. I appreciate all the support from everybody that was on social media when I posted about it. I do what I do because of you, the audience members out there. So I appreciate the support, appreciate the well wishes. Glad to be back. Glad to be a lot healthy. Doc says fatigue is probably going to last a couple more months, maybe a year. That's what they've seen with similar patients. So, but yeah, we're going to get back on track. So before we get into today's podcast, I want to give a shout out to an organization that was recently on our podcast. That's First in Wellness. And we here at AFSO 21, myself included, we are excited to be joining up with them, promoting their products, promoting the healthy lifestyle, physical fitness within the firehouses, emergency services. So take a few seconds, listen to their promo, and when we come back, we'll jump into today's podcast, which is going to be the topic. We're going to talk about volunteer fire service and the $1 million question that's been going around: is it on life support? So stay tuned. We'll be back. Being an emergency responder involves risks, but you have the power to mitigate such risk. Kevin Farrar here from AFSO 21's Weekend Wrap-Up Podcast, and I want to introduce you to First in Wellness. Their mission is to provide affordable and easy-to-follow programs that don't require a complete lifestyle change to experience more energy, restorative sleep, and confidence in your body. Offering individual and group programs that produce guaranteed results without sacrificing your long-term health and well-being, First in Wellness is so confident in their programs, if you're not satisfied in the first 60 days, they'll completely refund your money. For a limited time only, use promo code AFSOFIT15 to get 15% off their First in Fitness program, or use AFSORES50 to get 50% off their First in Resilience program. First in Wellness also offers grants specifically for group resilience program. To learn more about First in Wellness, head over to firstinwellness.com. That's firstinwellness.com. All right, folks, we are back. And again, thanks to all of our audience members that continue to support AFSO 21 Weekend Wrap-Up and AFSO 21 LLC itself. If you have not done so yet, please subscribe, hit that subscribe button, hit that like on social media or whatever podcast platform you're listening to. We appreciate it. The more followers we have, the more audience members, obviously, and the more our messages about firefighter health and safety get out across the globe. And we are global, folks, so we definitely appreciate that. So, again, the topic of this podcast is going to be talking about the volunteer fire service and really the $1 million question: is it on life support? Before we get started, let's go ahead and pause a moment. Today marks the 19th anniversary of the Station Nightclub fire. Those in the fire service, this was a significant incident that not only impacted the local community, but also the fire service as well in terms of fire code, life safety code. For those unfamiliar, the Station Nightclub fire up in West Warwick, Rhode Island. It was not a small nightclub. It was a fairly decent sized nightclub. Not your typical wide open venue. This one was, the layout was, a little tight, if you will. Had somewhat of a maze to it, and because of that factored into the reason why they had such a significant fatality and injury rate. Sadly, 100 nightclubbers, 100 patrons perished in that fire. An additional 230 were injured. Some minor, some major, to where they had to be hospitalized. But at the end of the day, various life safety code issues were involved in this, namely the use of flammable soundproofing material that really was not approved, as well as the egress areas. For those familiar with this incident and have seen the video, I'll put a link up there. For those that haven't, that shows the actual start of the fire, which started because of pyrotechnics from the band. It ignited the flammable soundproofing material behind them. Initially, audience members thought, "Oh, it's part of the show," and you see the fires progress, intensify rather quickly, to the point, it did not take long to overtake where the band was and where the nightclub patrons were gathered. Most of them were standing. There was a bar section in there as well. But panic immediately set in. Everybody made a dash for the front door, because that's where those in the fire service, most people, when they evacuate, they're familiar with, hey, this is where I came in, this is where I want to go back out. So a lot of the patrons, they made a dash for the front door. Unfortunately, there was a jam up at the door. It wasn't big enough to allow proper egress, and individuals started to become really, lodged in the doorway. And then as everybody tried pushing, individuals started stacking up, and that's where most of the fatalities took place. There was intensive investigations with this particular incident. There was other exits within the building. Had patrons known about those, it's very likely the fatality count would have been less than what it was. Injuries as well, and people have armchair quarterback this tragic incident a lot. But I just want to go ahead and take a moment, to pause here for a bit. Remember the victims of the Station Nightclub fire. And, as we pause here, think about, facilities within your own jurisdiction that could be similar or need to be inspected to make sure a tragic incident like the Station Nightclub fire doesn't happen again. So let's just take a few moments to go ahead and pause and remember those victims, and we'll move on from there then. All right, folks. I appreciate it. Again, tragic incident. Please click on the links that I share with you. Take a look at this. Talk about it amongst yourselves in a firehouse, and get out there in your community and inspect these buildings. So getting to the topic, volunteer fire service, is it on life support? And we've seen a lot of media, news media talking about this, especially here in Pennsylvania, here in the Commonwealth, with departments reorganizing, merging, consolidating, however you want to call it. It's happening in the volunteer fire service, and there's a reason for that. There's actually multiple reasons for that, and we're gonna talk about a few of those. And it's interesting, because when I was out in exotic Beaver Creek, Ohio last year for the 4th annual Firefighter Health and Wellness Conference, before the conference started, a group of us, we went out to dinner, and this topic sort of come up in conversation, some informal discussions. And, I had simply asked the other firefighters that were there in attendance, I said, just enlighten me. I said, what is your level of certification, your minimum level of certification at your respective firehouses? And there was a lot of West Coast firefighters there that were career, some Midwest, and, obviously, in each area was somewhat represented, of the United States. But the majority, I would say really everybody, said minimum level of certification is firefighter 1 EMT, if not firefighter 2 EMT. And I understood that because the majority of these individuals were in a career department. So, naturally it's like, yep, you're paid, you got minimum standards, this is what they are, and you go from there. So I jokingly said, who wants to guess what the minimum certification is here in Pennsylvania? And somebody chimed up and said, driver's license. And, we all laughed about it. And, most of the firefighters there thought it was simply a joke. And I said, oh no. I said, you don't even need a driver's license in Pennsylvania. And they're like, what? I said, I can literally go out here in the corner. I can walk through this restaurant and pick anybody and say, hey, you want to be a firefighter in Pennsylvania? Come on. We'll sign you up. We'll get you into the department. We'll get you a set of turnout gear, and you can ride the truck, fight fire, as you want. And you sort of felt a hush amongst the firefighters and almost like a cringe because they're so used to, mind you, most of these firefighters were career. Everybody was like, they're so used to those standards, they couldn't believe that Pennsylvania does not have a minimum standard. And it's true, folks. I mean, it's, I'm working with the state fire commissioner, I'm working with the state legislators, really to try to change this. And it's getting a lot of pushback, surprisingly, from volunteer fire service organizations here in the Commonwealth. And we're going to talk about that. So the big one to start off, asking, why is the volunteer fire service on life support? And, first and foremost, membership. Hundreds of thousands volunteer firefighters here in the Commonwealth of Pennsylvania. At one point, we're down to about 30-some thousand right now. Folks are, legislators, the State Fire Academy, State Fire Commissioner, anybody in the fire service here in Pennsylvania, they're trying to figure out, why do we go from so many down to so few? And, a lot of folks, they're saying, well, there's really no incentive to be a volunteer firefighter anymore. A lot of the younger generation, the millennials, whoever, you want to call them, the next generation of firefighters, the youngsters coming in out of high school and everything, they just don't see the incentive to be a volunteer firefighter, because when you compare career and volunteer firefighters, realistically, and I appreciate their argument, is that here you have a volunteer firefighter that joins the organization, has the best interests of the community in mind, but at the same time, they look at their counterparts in a career department who are getting paid to do the exact same job. They're getting paid a salary. They're getting benefits. All of these benefits and luxuries come with being a career or even a combination department, paid on call. But when you're a totally all volunteer department, you don't get anything. You roll out that door, not knowing what you're getting yourself into. And if you're injured or killed, you get some, your beneficiaries will receive X amount of dollars from the state or the organization, but it's really, let's be honest, nothing in compared to what they may receive from a career department. As if you're an employee of a paid department, you're going to get X, insurance, medical, maybe life insurance, vacation time, a good salary, and some other things. Whereas in the volunteer department, you don't get that. And, now mind you, I appreciate, I'm a volunteer myself, have been really since 1988, been involved in the volunteer fire service. Even when I was active duty military, we dealt with volunteer firefighters, and we worked side by side, different installations I was at. And then when I retired, I come back, joined, I was already a member of one department, joined another one. So, the contribution is there. I get it. I respect those that serve and sacrifice, their time. They're volunteering. But it's a challenge to understand why, like my generation, the generation before me, everybody, when that alarm went off, the sirens went off, the house sirens, people dropped what they were doing and came to that request for service, that emergency call. Unfortunately, today that's not happening, and we look at that membership. Recruiting and retention is the big one. You're going to see and hear this, here at AFSO 21. Hopefully you're hearing and seeing it within your local communities. The news agencies, various fire service organizations are talking about this. They're having classes on it. And some things work, some things don't work. And, for this podcast, I'm not going to really, I've got my opinions, but I want my audience members to openly discuss this, either, when I post it on social media or even on YouTube channels, comment on this issue on whatever platform you're listening or watching this podcast with, because I think that encourages more conversation and encourages more participation, if you will, from audience members. Because again, what may work here locally, and my department is doing fairly well. Since I joined, we saw an increase in membership, more folks coming around, more folks responding, which is great. Unfortunately, other departments here in my local area, we're not seeing that. There's a decline in membership. But again, what may work in my department may not work in yours. But what works in yours may not work in mine, but it may work in somebody else's. So that's why, I really want audience members. I want you all to go ahead and chime in via comments, share what's working, what's not working. Let's have an open discussion on this through the various platforms. And hopefully at the end of the day, we can go ahead and, maybe not resolve the recruitment and retention issues within our organizations, but we can mitigate them a little bit to where we enhance, we better our organization. So that's really all I got to talk about with membership. Here locally, in the Commonwealth of Pennsylvania, second-class townships are entitled to initiate a fire tax, and we're seeing this occur more and more throughout the Commonwealth. Because let's face it, career departments, you have a tax revenue from whatever city, organization, government, local government that you're operating under. Whereas in the volunteer fire service, unless there's a fire tax initiated, fundraising's on your own. These are nonprofit, private organizations, and as such, they rely on donations. We've seen some organizations out there now charging per response. They've got a chart that says if we roll out on a flue fire, for example, this is what it's going to cost: manpower, equipment, yada yada yada. So they're not necessarily billing the owner; they're billing the owner's insurance. But we're only seeing a fraction, a very small portion of the volunteer fire service here in Pennsylvania doing that, and really across, sort of here in the East Coast. Because let's face it, West Coast, pretty much from the Midwest on out, you can almost guarantee they're going to be a career type department. And then like Central, on back to the East Coast, if you were to take America, split it in half, so you've got the western side of America, they're pretty much, like I said, career or a combination. In the east side of the United States is more, we're seeing more and more with combination departments, but there's still a large volunteer presence, especially up and down the East Coast. a lot of volunteer departments, and they're all going through this same issue. So, fire tax here in the Commonwealth of Pennsylvania, we feel it's going to become a standard. For me, I'm watching this closely. I'm seeing and hearing legislation being discussed on this, and discussions within the volunteer firehouses and local communities, local, like I said, second class townships, more so townships than you see boroughs or cities or, stuff like that. The smaller communities, we simply, I simply feel that the fire tax is going to become a reality. It's going to become a norm. The scary part about this is here in the Commonwealth of Pennsylvania, local government can initiate a local fire tax up to a 3 mil without a public vote. So while they may establish something low just to see how it benefits a volunteer fire department, they can come back in year 2, 3, 4, whatever, and say, hey, we still need to go ahead and provide financial support to these fire departments. We're going to raise the fire tax up to a 3 mil. And depending on where you live, that could be significant. I mean, we're talking, thousands, tens of thousands of dollars, depending on, how much property you own. And it's based off of your property assessment. So if you have a McMansion, as we call them, you're looking at, hundreds of thousands of dollars in property value, assessed value. Fire tax could be significant. So, on the flip side of that, I've talked to a lot of folks here in my area and throughout the Commonwealth, and, they're not necessarily, and residents, we're talking about residents here, they're not necessarily opposed to a fire tax, but the big concern that they have is that if they are required to pay a fire tax because their local government establishes it, they want to know what type of service they're getting. And that's a valid concern and something I've addressed with local governments, agencies around here, as a consultant for residents and, who address this. They're like, okay, I'm paying X number of thousands of dollars in fire tax. What am I getting in return? And a lot of times we're seeing the local fire protection emergency service organizations not responding. And these residents are like, well, wait a second. I'm paying all of these, hundreds, thousands of dollars to support these organizations, and they truly do support them. These residents at the same time are like, well, we're not seeing or hearing the fire departments respond. So why should we pay to support an organization that simply doesn't get out or gets out very few times? So, and again, here in the Commonwealth of PA, volunteer fire service organizations are private entities. They're private organizations. But it becomes a little cloudy once they start receiving taxpayer funds, fire tax, in terms of when I talk about it being cloudy, the question is, okay, is there some sort of governmental control, local governmental control over the organization because they're distributing taxpayer funds to them? And here in the Commonwealth of Pennsylvania, at the end of the day, the second class township code does clearly state that local agencies, i.e. townships, are responsible for providing fire protection and emergency services to their local community by the means and extent as defined by the local government. Unfortunately, with that, we're seeing a lot of local government not really aware of their responsibilities with that. And that's where, it goes back to, okay, yeah, they've got a local fire department, volunteer fire service organization that's recognized as the service provider. But if you don't have anything defined, and this is where the difference between career and volunteer service comes into play. If a local agency doesn't really have anything defined, in terms of this is our needs, this is what we expect you to deliver, no matter what, or in lieu of fire taxes. If that's not established, then really the local volunteer fire service is going to do what they want to do, and go from there. And again, career department, things like that are established. City council, city has ordinances, has standards in place that says, yep, this is what the fire department's going to do because we're paying your salaries, we're paying for your equipment, yada, yada, yada. With the volunteer fire service, again, here in the Commonwealth of Pennsylvania, legislation is lacking in terms of these are the minimum standards that volunteer fire service organizations have to abide by. I'll be honest, I've talked to several legislators. They really don't want to rock the boat by establishing standards because, again, we all appreciate volunteer firefighters. They serve and sacrifice at their own will. Nobody's forcing them to join and respond to these calls. And I think that's what legislators are afraid of, is that once they establish these standards and requirements, they're going to see a decline in membership and capabilities. And most likely it's going to happen. So that's why we resort back to, do we need to establish a fire tax as payment, as incentive to recruit, retain, volunteer firefighters here in the Commonwealth. So discuss that amongst yourselves, discuss it on our platforms. We love to hear what is working in your local community, or state, or country. Again, we're global, as opposed to, really what's going on here in PA. And if, all my PA listeners, please, if you're hearing something different, please chime in. If you're participating in legislation, standardized, the volunteer fire service, I'd love to hear from, what you have to say. So, it's with the fire tax, it's sort of, it goes into, we talked about legislation. It also brings up the whole, when we say standardize, say, okay, this is going to be your minimum level of training certification. So that draws in industry-wide standards. So you've got your OSHA standards, you've got your NFPA standards. I've heard talk here in Pennsylvania that, and it's coming down the pipeline, the minimum level of training certification for firefighters across the board could be Firefighter 1, which is pretty much exterior firefighter. Then you get into the Firefighter 2, a little bit of interior, vehicle rescue, stuff like that. My DOD listeners out there, you walk out of the schoolhouse, Firefighter 2, airport firefighter, hazmat, awareness, ops. I think they're working EMT now, maybe minimum EMR. So you get a lot of basic essentials fire training when you come out of the DoD Fire Academy. Unfortunately, and don't get me wrong, I'm not ragging on Pennsylvania, but at the same time I am, because it's frustrating to see community members unaware of really what's going on in Commonwealth of Pennsylvania firehouses. So NFPA standards, it's an industry standard. It's not law. However, depending on how the local agencies, local governments adopt those and utilize those, they can be used as a law or an ordinance, and be enforceable, hold individuals accountable. And that alone, I think, is another reason why legislators, local departments, your local volunteer fire service organizations are sort of reluctant to adopt those NFPA standards, simply because they're not aware of what these standards are. They're not aware that you're not required to adopt them all. You can adopt, certain standards, and it may not be the current standard. You may say, we're going to adopt a previous edition based on whatever criteria. And that's how, building codes here in Pennsylvania do. They don't necessarily adopt the latest standard. They may adopt standards from decades ago, which is absolutely crazy to believe. You would think they would keep up, with current standards, but that's a whole different podcast in itself. But yeah, NFPA standards, I think, and it's ironic because certain types of training here in the Commonwealth of Pennsylvania, they utilize NFPA standards as well as, like IFSTA manuals. So, you go through the essentials of firefighting to get firefighter one. Well, guess what? The essentials, IFSTA essentials, utilizes or references NFPA standards. So it's not like you're applying, a third party standard. So if they're willing to do that, why aren't they willing to utilize or adopt other NFPA standards? One pushback that I had heard from a local agency was, it's going to cost us money. Not necessarily. It's you can establish ordinances and requirements within your local government and say, look, we require this from our local emergency responders because we want the best level of service, the optimal level of service, if you will, for our community members. Because again, it goes back to, and there's been news stories on this, where here in Pennsylvania, you can simply sign somebody up, and they can be a firefighter. And what the state has done, the Commonwealth of Pennsylvania has done for so long, is grant the local agencies, or should I say, grant the local volunteer fire service organizations the authority, if you will, to establish minimum standards. So here in the area where I'm at, you may have one organization that says, yes, everybody will be firefighter 1/2, depending on the position you're in. You will be required to have hazmat awareness, operations, be an EMT, et cetera, et cetera. Whereas an organization maybe right down the road from that one has a completely different set of standards, if anything at all. So that's what, and again, it's not just in Pennsylvania, it's up and down the East Coast. There's no true standard, if you will, for the volunteer fire service. As opposed to career or combination, you're going to see more strict standards being applied, requirements. If you look at all the job offers that are being posted out there on social media, you'll see these are the minimum requirements that you have to have, because it's a career, it's a paid position. You're receiving compensation in lieu of service. And again, that compensation is taxpayer money. Whereas in the volunteer fire service, yes, you receive taxpayer funds. They're applied certain different ways. But again, if you have a fire tax question at hand from, at least that I've seen from resident is, if I'm paying all of this money, I expect this out of my local responders, to respond to calls, to be trained and certified to certain levels, similar to their counterparts, in EMS or law enforcement. To be an EMT here in Pennsylvania, you have to go through a course and be licensed. You have to meet certain levels of training and certification. Same thing in law enforcement. It's and I volunteer. As a volunteer firefighter, I'm a volunteer firefighter EMT. So I'm out there. I'm not getting paid as an EMT. I'm volunteering my services as an EMT to the local organization. but I can't do that unless I'm trained and certified to certain standards. I didn't go through the NREMT because I have no desire to move out of Pennsylvania at this time. And again, it wasn't required, so I'm Pennsylvania Department of Health certified as an EMT. Pretty much it's the same. They're using NREMT curriculum. We just didn't do the NREMT skill sheets. So, that's things to talk about. So again, chime in. Let me hear what you're doing in your local areas, whether you're paid, your career combination or volunteer department. Would love to see what's going on out there and what feedback you're getting from your local residents, your local community, in terms of if you have a fire tax in place. What are the questions? What are the concerns that they have? And what is your organization doing to better serve the community in terms of all that? So, I've got on my notes here, accountability. It goes back to, if you don't adopt standards, if you don't have minimum standards, requirements established, how do you hold individuals accountable? And it doesn't matter whether it's career, combination, volunteer, EMS, law enforcement. If you don't have policies in place that dictate this is what each member must have, must maintain, must do, the organization overall must do, how do you hold these organizations or yourselves accountable? What does the local community residents have in terms of when you roll out, if you get injured or if you injure somebody else or something happens on the incident scene, how are individuals held accountable for all of that? Sorry, I think I just spit on the mic. So yeah, that's something to think about and talk about. So again, you're gonna hear throughout this podcast. There's a lot to talk about, and I really do hope that folks chime in and comment about this, because again, it's we can share the information, best practices. It's all a learning environment, learning opportunity. This podcast to discuss these issues. So, the big one on here that I have, when it comes to leadership, I've seen some really, really, really good volunteer fire chiefs out there that are truly leading their organization and doing everything for their members, their department, their community. And then at the same time, I've seen some really, really, really bad leadership out there that, let's be honest, they really don't give a damn. They're going to do what they want to do. And that, that's toxic to an organization. It doesn't matter if it's a fire organization or whatever. When you have toxic leadership in an organization, that toxicity flows through that organization. They may not see it. Other members may not see it, but it's there. Sort of like PFAS. And yeah, you're going to, I've seen to where leadership simply doesn't care. They're doing what they want to do. They don't want change. And then, other things that they're doing. So then that toxicity flows down to the newest members, and they're like, well, if the old man doesn't care, the chief doesn't care, why should I care? Well, at the end of the day, it's really not about us as a fire protection emergency services provider. It's about the local community. Yes, we want to be the best that we can. We want to, the best trained, the best response capability. The list can go on and on and on. But at the end of the day, who do we serve? we're not, when that alarm rings, we're not serving ourselves, we're serving the community. And when those tires start rolling, those trucks are out the door, um, community members on the receiving end expect those that are coming to help, whether it's an EMS, law enforcement, fire, you name it, they expect those that are arriving on scene to be well trained, well educated, well prepared, to do the tasks necessary for that call for assistance, to render assistance. So again, if it's just a simple lift assist, be well spun up on it. If it's a flue fire, if it's a work and structure fire, if it's a vehicle accident, get educated, get certified on this. At the very least, get educated. There's numerous organizations out there that provide amazing education, but they don't provide either an IFSAC or a Pro Board certification. And does that matter? That's a question. Does it matter, if I don't have these certifications, but I'm educated? Yes and no. Here in Pennsylvania, if you want to get educated, because there's lacking minimum requirements, you can get all the education you want from whoever you want. But if you are going down that path to be properly certified, recognized, and Pennsylvania and other states have similar programs out there to where you are recognized for your capabilities. ISO ratings, those factor in training, certification capabilities to reduce those numbers and reduce the fire insurance premiums. So that's another angle that I tell organizations. It's like the better your organization is set up, the more benefit goes back to the community in terms of response capability, insurance premiums, all of that stuff. So, but leadership really has to play a part in doing the right thing. Again, if you have a toxic leadership, it's going to affect the department. Morale is the big one, and that could play in. We've seen this. That plays into that recruitment and retention within the volunteer fire service organization. Is that toxic leadership? You'll have members, youngsters, still in high school that are, they're like, yeah, my dad was a firefighter, my grandfather was a firefighter, it's in the family, I want to do it. But the jurisdiction that they reside in, they're like, yeah, but so and so, they're in these officer positions, and I just don't know, and so that detracts them from wanting to join their local fire protection emergency service organization. And ultimately impacts the community, because again, if you don't have the members, you can have all the fanciest equipment, the most modernized equipment, everything out there. You could be the envy of any department by having all of this equipment. But at the end of the day, if you don't have manpower to staff and operate that equipment, what's the point? You might as well just turn everything into a museum then, because really, if you can't get it out the door and utilize it like it's supposed to be, and utilize your personnel like they're supposed to be, trained, certified, properly equipped, and the list goes on and on and on. Having a brand new, $1 million apparatus, whether, no matter what it is, having brand new sets of turnout gear, having, the latest extrication equipment. And again, it goes on and on and on. That's all great, but it's going to collect dust. So again, leadership, and, I'm talking a little bit here about, the officer positions, but at the same time, when we talk about leadership may come from the lower ranks within your organization. The brand new firefighter that's coming in, the firefighter that's been in the department for several years, but just doesn't desire to be a line officer. They'd rather continue being a firefighter, but still be involved with certain things, management, organization of the firehouse. So, that's leadership, and those in the higher positions, I call them the executive positions within the organization. They need to recognize and respect those individuals and encourage input from them. Because I've said it before, others have said it. Those of us within fire protection emergency service organizations, it's a team environment. It's not an individual environment, meaning, those tones drop. One person is not going to take a truck out and do everything. They're like all pieces of a puzzle, and you got to put that puzzle together to make that organization work and function and be respected within the communities. And if you're missing a piece or two or three or more, you can't see the picture. You can't be very effective. So we can talk on and on and on about that. That could be another podcast. Who knows? But like I said, chime in. I wanted to talk about this, because of things that are going on here in the Commonwealth, and I've seen, up and down the East Coast, it's making the news a lot. The volunteer fire service, and again, it's not just here in Pennsylvania. I've talked to, like I said, I've talked to the state officials. Things are in the works. They may not be immediate, but things are in the works to apply and initiate that. At the end of the day, is going to better serve our communities. You're going to have those that know I created an emergency response capability program for the Air Force. They're still using it. They sort of butchered it a little bit, but it's still in use. And it lays out, based on certain factors, what a department's capability is. It's available. It's mine. Now that I'm a civilian, I've tweaked it to where it's mine, and it's available. As I consult, fire service organizations out there, I'm like, this is something you may want to look at. But it's like I said, there's factors out there that it incorporates: manpower, training, apparatus, and service. Different things. These are things that need to be factored into in terms of capability, and the end goal is to be optimal level. Maybe reduced depending, but and it doesn't matter whether you're career, volunteer, whatever. If you're involved in emergency services in some fashion, the primary stakeholder is community. The residents, business owners. So throughout this podcast, you heard me talk about community members. We're looking at stakeholders with all of this. So these are things hopefully you're discussing within your firehouses amongst yourselves, and ask yourself, why do we do what do we do? Make sure I said that right. Why do we do what we're doing? And what's the benefit of doing what we're doing? But at the same time, ask yourself, what should we be doing that we're not doing? And what's the risk to the stakeholders, to the community, by not doing what we should be doing? So these are things, you should be asking every day. That's why we do community risk assessments. We do needs assessments, standard of covers, all of this stuff. Management assessments. There's a lot that goes on in terms of assessing an organization, and unfortunately, that's really not being done especially in the volunteer fire service. So, again, as you're watching this or listening to it, whatever platform it's on, please like, subscribe, follow us. We're always here. I'm always here. I talk about AFSO 21. It's pretty much just me as a consultant and podcast host. But seriously though, I'm always here. I try to answer all the mail that I get, and the messages. If I have not responded back to something you've asked me for or asked me about, send me another message. I'm going to put my email address up there as well. Reach out to me, and we'll try to get things squared away. I've had a lot of conversation here lately about PFAS blood testing. As you know, I've been working with Eurofins. They've got a new PFAS blood test kit out on the market. It's $299 now, but I think that could be for a limited time. When they first introduced it, it was $399. It's down to $299. This test is more accurate than what the DoD is doing. What's unique about their test is that when you get the test results back, it'll show you Eurofins blood test results, and there'll be a column that shows you how that correlates to the CDC NHANES in terms of levels. And as some of you know, I got the test. They found elevated levels of PFAS, PFHXS, and a few others in my body, which was shocking because it's been 30 years since my first exposure out at Chanute Air Force Base, but I was exposed other times throughout my military career. And it's not just firefighting foam, it's also firefighter turnout gear. And if you've been following the news, there is a lawsuit that was filed by some folks up in Massachusetts and New York. One of them involved being Paul Cotter. You may recognize that name. His wife Diane is the one that really kickstarted the whole PFAS and turnout gear investigation. Dr. Graham Peasley from Notre Dame University was involved in testing about 30 sets. He's been on the podcast before talking about that. And he found, I should say, high levels of PFAS in turnout gear. And, it's suspected that the amount of PFAS that was in these various brands of turnout gear, it wasn't just one company, it was numerous brands, numerous age of turnout gear. It's highly suspected that PFAS caused various forms of cancer among firefighters, namely prostate cancer. Because when you look at turnout gear, and there's been different studies out there where the moisture collects, where the soot and all, everything else collects. It's usually armpits, neck, groin area. So it's a no-brainer. Even if you don't get into a toxic fire, if you're just wearing your turnout gear every day, military folks know this. You get very, very few fires, but you're donning your turnout gear a lot for training and other incidents. You start sweating, especially those in the hot and humid climates. Armpits, neck, groin area, you're sweating. As you're sweating, that sweat comes in contact with the inner liner of the turnout gear that has PFAS on it. And then your body absorbs that through the skin, starts collecting, gets into your blood, and we can go from there. These are, excuse me, these are really assumptions as to how, cancer forms within firefighters, routes of exposure. Studies are ongoing to really pinpoint and prove that, because garment manufacturers are kicking it back. They're like, oh no, that's not how that works. Foam manufacturers are kicking it back, saying, "Hey, yeah, our products are safe." So yeah, I'll have a link to that news story as well in our different formats here. Make sure you take a look at that. Make sure you share it amongst yourselves. Talk about it in the firehouse, because this is going to be a pivotal case for firefighters. Rob Ballot did it with the West Virginia folks that were contaminated by DuPont, civilians down there. Now we're doing the firefighter thing. I think this is going to set the pace for other lawsuits to come. So yeah, make sure you watch this one closely. And who knows? Maybe that's why legislation really isn't passing, because they want to see what the outcome is on this case. But that should not stop legislators from passing protective measures for firefighters. Especially the Mike Leasick Military Firefighter Protection Act, that's still sitting in Congress, has not moved since June of last year. That particular piece of legislation, you've heard me talk about this one before, would establish presumptives for military firefighters, meaning if they develop various forms of cancer and or medical illnesses or conditions, it would be presumed those cancers or illnesses and conditions are linked to being a firefighter, military firefighter. You wouldn't have to go through anything to prove it. It's just, it would be presumed, yep, you have cancer, this type of cancer. Oh, you were a military firefighter. Yeah, we're going to link the two and go from there. Sadly, military folks know the VA is pushing back on claims, regarding cancer, PFAS exposure. They're still not doing a blood test. I'm working on that from this end. It's 2021 saw some change, not enough. 2022, I really do hope we see the change that needs to happen to protect firefighters. And I've been talking to several firefighters here recently. Big concern, and most of the audience members know the 2020 National Defense Authorization Act defined what a firefighter is in the military. Unfortunately, Navy personnel that are tasked to augment firefighters, quote firefighters, on ships are not eligible for PFAS blood testing, nor are fire truck mechanics, nor are hangar fire suppression technicians, installation and maintenance technicians. So, all these folks at some point were or are or will be exposed to toxic firefighting foam. But until legislation is amended and passed, these individuals cannot get a blood test, which is total BS. The military knows these folks are exposed. Congress knows these folks were exposed. It sucks. So I'm gonna put this shout out to, hopefully within the audience there are these listeners. I want, because I can talk to Eurofins and try to make this happen to get you a blood test. Of those three people I talked about, I want a naval personnel that was exposed to AFFF, that's not a firefighter. This is my request to audience members out there. I'm seeking, and I can only do this for one, so whoever chimes in first is the winner. I want to talk to naval personnel, non-firefighter, that augmented firefighters on, let's go with an aircraft carrier that used or was exposed to AFFF. I want to reach out. I want to talk to fire truck mechanic that worked on the foam system on fire apparatus. And I also want to talk to a hangar fire suppression system technician that went in, had to repair it, and came in contact with AFFF. So I want to talk to these individuals. I want to hear their stories. I want to hear their experience, and I want to be able to get those individuals tested for PFAS to show that it's not just firefighters who are exposed to PFAS have elevated levels. It's also these individuals, the separate group of individuals. Now we know in military installations, damn near every Air Force installation out there, really military installation, if it had an airfield, if it had a flying mission, they were using firefighting foam. Even on the structural trucks, they were using Class B foam, which contained PFAS. So, the DoD is really pushing back. The Air Force is pushing back, especially up at Wurtsmith. Former Wurtsmith Air Force Base up in Michigan. They're really pushing back on this whole PFAS issue. They know the contamination was there. They just don't want to acknowledge it. But yeah, every military installation, I think it's greater than what the DoD task force is saying. 700 plus installations. I don't think they really factored in overseas installations that are active, former. I think the numbers, just like the PFAS blood test levels that they're providing, those are low as well. Speaking of PFAS blood test levels, those within the DoD, if you had a blood test done, take a look at your lab results. I'm finding of those that provided me their results, a discrepancy that is significant. The latest one I saw, the lab, it came from LabCorp. I don't think they actually did the test. I don't know. The DoD is sort of, silent on this. Nobody really knows who the hell's doing the blood test. But LabCorp sends the results back. One individual I talked to, their PFHXS level. That's one of the PFAS analytes, one of the 10,000 analytes out there. PFHXS. Their LabCorp report simply showed greater than 10. It did not provide a specific level as they're required to do. Okay, all the other levels showed a decimal amount. I'm just throwing a number out there. This isn't what it was, but say like 3.470. Okay, that's the format that should be on your PFAS blood test results. This particular report showed greater than 10. And the concern that I have, and if you're seeing the same thing on your blood test result, you should have as well. What is that amount? Is it 11? Is it 90? Is it 1,000? You as the patient have 100% right to know what that level is. And if they don't provide it, reach out to me and I will get involved, because they are in violation. You have to provide the patient with the number. Okay, not just, it's greater than this. And this is what I fear is happening within the DoD. And see, now I'm getting riled up. I really didn't want to talk about PFAS, but I am. This is what I fear is happening within the DoD, is that they are tweaking these numbers. They are intentionally skewing or restricting these numbers because they don't want the public to know how bad military firefighters, whether you're DoD or civilian, how bad firefighters have been exposed and continue to be exposed to toxic PFAS. They want these numbers lower so they can come back and say, well, look, it's only this amount. Nothing to be concerned here. Bullshit. Again, PFAS is a man-made chemical. It's not natural. It should not be in our bodies. Anything above 0 is considered elevated. I've talked to scientists. I've talked to researchers. I've talked to other colleagues that are dealing with this. And we all agree, anything above 0 in the human body, you're elevated. I don't care what the CDC and Haynes report, what their numbers mean. I do care what they mean, but I don't care that the fact they come out with this wild ass guess and said, okay, well, these are the averages. This is what we consider to be, if it's above this level, we should be concerned. It's sort of like the EPA 70 parts per trillion in drinking water. Again, bullshit. It's PFAS. They're man-made chemicals. Drinking water should have 0 PFAS in it. Should not have any PFAS whatsoever. But again, the EPA 70 parts per trillion, unenforceable. There's no teeth. There's no legislation at the federal level that says, yep, if it's above this, you can, we got to do this. We can hold this person accountable. It's simply an advisory. It's a lifetime health advisory. Okay. It means something, but at the end of the day, it means nothing. Fortunately, some states are establishing their own thresholds. But again, this is where you as veteran, firefighter, taxpayer, community member need to be involved in this legislation and tell your state legislators or your federal legislators that, hey, anything above 0 is unacceptable. So go back and revise your legislation, or if you intend to pass something, make sure it is at this amount. And this is the problem we're having, is that, like the CDC, the VA, they're saying, well, all of these consumer products, have been out there for years, like Teflon cooking pans. And, it's inevitable that, the human body, Americans, it's likely 96% of Americans have detectable levels of PFAS in their bodies. That's great. I get what they're trying to say is because of all of these hundreds, thousands of consumer products that were sprayed or contain PFAS, our bodies consume that in some fashion. But legislation can be passed today if legislators simply got off their ass and did what's right, rather than fight over whose name's going to be on the bill, or not, vote no because they're pocketing campaign funds from certain chemical manufacturers. And I'm going to name his name, Congressman Fred Keller of the 12th District here in Pennsylvania, who I've tried to reach out to several times, but he ignores my emails. I found out that he's receiving campaign funds from DuPont Chemical, and that's why he's not voting yes on PFAS legislation. There's been several pieces of legislation out there to where it would protect community members, protect firefighters, but he voted no because he was opposed to certain timelines. And we're talking years we're in these timelines. So I did my homework and I found out, yeah, Mr. Fred Keller from the 12th District here in Pennsylvania, Republican congressman, is voting no simply because he's receiving campaign funds from one of the big 3 toxic chemical producers, that being DuPont Chemical. So, Pennsylvania listeners, anybody really, reach out to Fred Keller's office, and I'll put a link up to his page. Send them some messages and say, hey, why are you voting no on this? But like I said, I've tried to reach out for several times here, last year and this year, and I've got crickets on this. So, I'm fired up. So, PFAS blood test. Like I said, audience members, if you are or know of naval personnel, non-firefighter, worked on a carrier, was exposed to AFFF, fire truck mechanic, military or civilian that were exposed to AFFF from working on the apparatus, or hangar fire protection system technician, maintenance, military or civilian, if you were exposed to it, let me know. Reach out to me. I'm going to have the links out there with my email. I want to hear from you, and I want to work to get a PFAS blood test to you. Real simple, quick turnaround, and then we can discuss the results and go from there. So, folks, I'm fired up. You can tell I'm back almost 100%. If I tried doing this podcast weeks ago, there's no way I would be up to doing it or this fired up. So that's going to do it for this episode. I've talked long enough. I've ranted long enough. We've talked about the volunteer fire service. We talked about PFAS and a few other things in there. So again, please like, subscribe, follow my channels, follow my pages. Whether it's on YouTube, the various podcast platforms out there, Facebook, Twitter, we're on there now. Love to hear some comments. Love to hear the feedback. Don't be afraid to talk about this. If you've been exposed to AFFF, even your turnout gear, file an exposure report. The evidence is out there that shows PFAS is in your turnout gear. File an exposure report. In fact, I encourage you to file an exposure report each and every time you don your turnout gear because it has PFAS in it. If anybody gives you shit over doing that, let me know. I've got connections out there. I will make sure there is no intimidation or reprisal on this because you have each of you have a right to go ahead and do this. And it should be documented because if something happens to you down the road, you have a paper trail that it was documented. So yeah, I got to stop, folks. I'm getting fired up. So with that, that's going to do it. I appreciate everybody that continues to follow me here, on this podcast and other avenues. With that, as always, stay safe. Keep supporting your fire emergency services, whether it be career, combination, volunteer. They need the support. They appreciate the support. So with that, that's going to do it for another episode. Look for me to be back probably in another 2 weeks. I try to do every 2 weeks until we figure something else out here. So with that, that's going to do it, folks. Again, please like, subscribe, follow, click whatever buttons are out there that you see. And until next time, I'm out of here, folks.